Okay, let's take you live to Queen's Park this morning. Question period is underway. That is the NDP interim leader, Peter Tabuns, asking a question.
Speaker, the Premier said he will take the advice of the medical officer of health. Why is the Premier not taking leadership and wearing a mask to protect our children?
And to reply, the Government House Leader.
Mr. Speaker, look, the member will know full well that this government has been taking leadership right from the beginning of the pandemic, even in instances where the members opposite refused to work with the government to ensure that Ontarians' health and safety was put first, Mr. Speaker. Every single time that we put a measure in place to improve health care in the province of Ontario, they have voted against it. Bringing on new nurses, they voted against it. When we brought on significant funding for our small and medium-sized hospitals, they voted against it. The most rapid build-out of long-term care in the history of this province, if not the entire country, they have voted against it, Mr. Speaker. We have brought forward incredible vaccinations in this province, Mr. Speaker. We have led North America in terms of vaccinations. We have led the entire North America in terms of our battling of COVID, and in every single instance, they have voted against it, Mr. Speaker. We will continue to work hard, working with the Chief Medical Officer of Health, to ensure the health and safety of all of the people of the province of Ontario, regardless of whether the Leader of the Opposition wants to work with us or not.
The supplementary question.
So I go back, Speaker. The Medical Officer of Health recommended to protect our children that all adults wear masks indoors. The Premier can send a very strong signal to adults across Ontario that this is serious and that they need to act. And so I ask, why is the Premier not showing the leadership that's required at this moment and wearing a mask?
And Government House Leader. No. Minister of Health.
You know, since the beginning of this pandemic, there is nothing that the Premier hasn't done to protect our children and our most vulnerable. From the very beginning, when we had no vaccines in the province of Ontario worldwide, we made sure that the initiatives that we did, the programs that we put in place, protected our most vulnerable, protected our most senior, protected our children. And we will continue to do that as a government, because we understand when you make investments in people, you make investments in community. And we've done that from the start. As the House Leader mentioned, you know, the investments that we have made in health care in the province of Ontario are truly historic, Speaker. And yet, when we ask members of the opposition to stand with us and work with us, they refused and they voted against our initiatives. We'll make the investments. We'll continue to do what the Chief Medical Officer of Health recommends, because we know it's the right thing.
Thank you. The final supplementary.
Leadership is not simply repeating talking points in the House. Leadership is taking the advice of the Medical Officer of Health, something the Premier says that he does, and acting on it. We need public education to move people. I'm not seeing those programs. We need vaccination teams, because vaccination levels are at incredibly low levels. I'm not seeing that. We need 10 paid sick days so people can do what the Medical Officer of Health says, stay home when you're sick. What is it going to take for the Premier to show leadership and actually act on the recommendations of the Medical Officer of Health?
Minister of Health.
Second in the world, Speaker. Only Japan was able to get a higher vaccination rate and therefore protection rate for their communities. Second in the world. We have nothing to apologize, and certainly no lessons need to be shared by you. When we make the investments, when we make sure that vaccines are available, we see results, and we have, Speaker, respectfully. We have seen the numbers of people who've stepped up and said, I want to protect my elderly. I want to go visit my senior in my long-term care home. I want to be part of the solution. And part of the solution, frankly, is making sure that your vaccines are up to date. We've done that. We've made those investments, and results prove that they have made a difference. As I said, we will continue to make those investments to ensure that the people of Ontario have vaccines, have boosters, have flu shots when they need them, and will do that work. I'm not going to take any lessons from the member opposite who refuses to support.
Thank you. Next question, the member for University Rosedale.
Thank you, Speaker. My question is to the Minister of Health. Children's hospitals are in crisis, Minister. At Sick Kids, care departments are running at 127% to 145% above capacity. And it's not just Sick Kids. Across Ontario, paediatric hospitals and care units have reached maximum capacity. What is this government's plan to help children's hospitals meet the increased demand for care?
Minister of Health.
Thank you, Speaker. You know, we have already put in place so many initiatives that are making a difference in CHEO in Ottawa. Imagine the ability for them to literally ramp up a second ICU because they saw the need in their communities. These are clinicians, these are hospital leaders who are doing the right thing, who are stepping up when we give them the investments and supports. So our early efforts, of course, we anticipated a surge in pediatric and took early steps to support the challenging fall virus season. We've already done early operational guidance with provided support, fall and winter surge preparedness and pediatrics capacity. We saw that in CHEO. We see now Sick Kids nurses who are doing education to ensure that nurses in other community hospitals know, anticipate, and are prepared for a uptake that we have anticipated and we are working towards. But the
Thank you. The supplementary question.
Minister, Sick Kids and hospitals don't just want to imagine, they want the investment so that they can deal with the very serious issues they're facing right now. Yesterday, Sick Kids began cancelling surgeries to cope with surging demand in its ICUs and its emergency department. Now, Sick Kids already has a surgery wait list with more than 3,400 children waiting beyond the clinically acceptable timeframe. What is this government's plan to help children get the surgeries they're waiting for?
Minister of Finance.
Mr. Speaker, you know, I had the pleasure and the opportunity to table the fall economic statement here yesterday. And, you know, our opposition said, where's all the new money for health care? Well, if they were here in August when I tabled the budget, which was voted on yes by this side and no on that side, they would recognize that there were $5.6 billion of new investments for health care. Mr. Speaker, it's because this government recognizes that we're investing in the surgical backlog, we're investing in home care, we're investing in community care, in acute care, more beds. We have a plan to stay open that we came back in the legislature in August, Mr. Speaker, to get the job done for the people of Ontario, and we will not rest until the investments that were neglected by the previous government making in the health care system. Mr. Speaker, we're going to get it done.
Order. The final supplementary.
Thank you, Minister. The Sick Kids emergency.
Okay, we appear to have lost the feed at Queen's Park there, but you could hear the New Democrat opposition going after the government about mask mandates and the situation at children's pediatric hospitals, in particular with the ICUs packed beyond capacity. The government insisting that it is spending enough money and has a plan to deal with the situation at those children's hospitals. So that is sort of the situation we are seeing.